we might get started. So good afternoon, everyone, and welcome to today's webinar, Unpacking the New NDIS Emergency and Disaster Standards. My name is Kerry Langford. I'm Head of Employment and ACT Manager at National Disability Services. Let's begin today with an acknowledgement to country. I would like to acknowledge the traditional custodians of country throughout Australia and recognise their continuing connection to land, waters and culture. I pay my respects to their elders, past, present and emerging. Before moving to the session proper, I would like to run through a few housekeeping notes. You have all been placed on mute, but we encourage you to interact with us. We want this to be an engaging and interactive experience for everybody. You can use the chat feature to ask questions. This session is being recorded and the slides and the recording will be available on the ACT COVID Hub, which is actually on the NDS website. Please note that this hub is open to both members and non-members. So I would like to start by welcoming our guest speaker, Mahishni Krishna. Mahishni is the State Director, New South Wales ACT of NDIS Quality and Safeguards. Mahishni will also be joined by Julie Basso to answer some questions following the presentation. So a little bit about Mahishni. She has over 10 years experience working with vulnerable communities, particularly individuals who have endured significant trauma. She has led multidisciplinary teams and has delivered numerous statewide programs. I'm now going to hand over to Mahishni, and I do encourage people to put some questions in as we go along. We will, at the end of the session, basically read out the questions that are there and also ask people to put their hand up to provide some questions as well. I'll hand over to you now, Mahishni.
Kerry, thank you so much, and also thank you to Susan and Kat for organising this session and for inviting me to speak about the new practice standard. I thought I'd start off by discussing just briefly, and most of you would know about the Commission, our functions, but I thought I'd put the practice standards in perspective and fit it into the different dimensions of our role. Kerry, if you could, I do apologise if we could move to the next slide. So I'll just briefly talk about the role of the Commission. Most of you would know the Commission is an independent Commonwealth government body, and the purpose for it is to improve the quality and services provided to NDIS participants. Our role is to regulate providers, but it is also to build capacity. It is not just about regulation, it's about working and collaborating with community.
Okay, I've done that, but nothing's happening. Okay, I've got a black screen.
Sorry, I'll continue. Is someone having some technical issues? I'll continue. So our role also is collaborating with providers and providing education and capacity building. One of the big things the Commission does is build capacity, and this is about focusing on development and education, as well as the compliance and monitoring we do. And this is about building capacity for participants to ensure that they can enable choice and control in a safe and high quality environment. Our role is also to collaborate with providers, build capacity, but also work with them and help them understand their obligations. We want to make sure that you understand what is required, and therefore both parties are working off the same, we're both working off the same obligations, and both of us have the understanding of what each other's roles and responsibilities are. We also register providers, and there are various other functions that the Commission performs. Those functions, so next slide please, Kerry. Those functions include our registration and quality assurance, which is where the practice standards fit. It is all about continuous improvement, looking at what is happening in the sector and where can the Commission provide more guidance. We also have worker screening information that's available, and I will briefly, subject to time at the end, may take some questions or discuss that. There's the monitoring, investigation and enforcement. There is our complaints function, reportable incidences, and also behaviour support. In all of this, the role is to ensure that participants can engage, providers are supported, and that we are all working together. We also work closely with state and territory bodies through information sharing and, again, working together, given we're all involved and a lot of the aspects like behaviour support and worker screening is co-regulated, that we make sure we're working together with our state and territory government partners to deliver high outcomes and ensure that everyone is working together. So that is something that we do quite a lot through information sharing. And recently, a bill was passed in Parliament, which will hopefully enable us to prescribe bodies. And that will also assist in us being able to share information with each other a lot, hopefully in a lot of an easier way and more of in an immediate manner, to be able to address any risks or just to be able to work together with introducing new things. I'll move on to the 3 dimensions of the quality and safeguards framework, which was integral in the establishment of the Commission. As you can see, our framework is based on, we have the developmental aspect, we then have the preventative arm and also the corrective arm. Our focus always is on trying the development and the preventative aspects first, and having the corrective aspect there should and if something goes wrong. Our focus is on how can we ensure there are tools and resources available? How can we make sure that we have open communication with providers and share as much information as we possibly can and work together? Under the preventative arm is where the practice standards come in. This also includes things like the NDIS Code of Conduct, which applies to both registered and unregistered providers. With the practice standards, I briefly mentioned it is about continuous improvement. It is constantly looking at the sector. It's constantly looking at what else is occurring out there. Are there recommendations being made? Are things arising that require us to have more guidance? And one of the practice standards, being the emergency and disaster management, which is what we're discussing today, was as a result of looking at what was happening in the sector. But you may also be aware there were 2 more practice standards that were introduced, being the mealtime management and also the severe dysphagia. Both of those practice standards also came about from feedback that we've received from the sector, from advocacy groups, around wanting more guidance and having things available that's clearly set out what is the outcome that we are together trying to achieve and what are the quality indicators to provide guidance to providers so that they know at a minimum what they need to have available. And lastly are the corrective measures that we have in place, and that can range from an educative piece all the way to civil penalties and banning people from working in the industry for either a short period of time or a permanent ban. One of our functions is provider registration, and that's where the practice standards comes in. Provider registration includes, we register providers. As part of their registration, there are obligations they need to comply with, which includes state and territory laws, including any Commonwealth laws in place, and the practice standards fit in as part of your conditions of registration. Unregistered providers still need to comply with the Code of Conduct. However, the practice standards applies to all registered providers. It gives you a minimum understanding or minimum standards of what is expected of you. As I mentioned, it relates to the outcome we're trying to achieve together and also the indicators that you can use to measure how to best support participants and what to have in place to ensure supports can continue. As of the 1st of December last year, residential aged care providers who are delivering services to NDIS participants also became registered NDIS providers. So from the 1st of December, the practice standards and other registration obligations also apply to residential aged care providers who provide support to participants. Again, if there are any questions, more than happy to take them at the end, as Kerry mentioned, or if you have it included in the chat, I'll respond to, and Julie's available to respond to those as well. Just moving to practice standards to say what they are briefly before I start talking in more detail about the specific one we're here to discuss. I just thought I'd set the scene a little bit before we discuss that. So practice standards include a core module and several supplementary modules, and they apply according to the types of supports and services that providers deliver, and also is dependent on your corporate structure, because the Commission's, one of our primary purposes also is to make sure that it is our approach and what we expect is proportionate to the size and the scale of the organisation. If you're a large provider, then there is obviously an expectation that you will address that aspect. And similarly, if you're a smaller provider, that is addressed as well. Registered providers are audited. The practice standards, both the new ones and the ones in existence, will form part of the audit, and you will be assessed in accordance with the quality indicators and whether or not the outcomes are being achieved as part of your regular audit. For those who are newly registered providers, you will be assessed from the 15th of November for the new practice standards. For existing providers, there is a transition phase. So the new practice standards will apply from the 24th of January next year, and any audit that will occur after will include an audit against your compliance to those practice standards. Most of you would have gone through audit, so I'm not going to discuss that process, and I think I'll just dive straight into the new practice standard and just provide some background as to the reason it was introduced. And the basis for which, as I mentioned, the reason it was introduced and the consultation that took place, and also the reason it was developed. So emergency and disaster management as a practice standard. This practice standard applies to existing providers from the 24th of January next year. So if you are already a registered provider, you have till the 24th of January to have your plans and your contingencies in place, your plans, procedures, and everything in place. But again, the purpose for the session today is hopefully to provide you a little bit more information and give you an opportunity to ask questions as you are undertaking that planning. For new providers and providers who are currently going through a renewal, the practice standards applies from the 15th of November, so 15th of last month. The purpose for the emergency and disaster management practice standard was to develop and strengthen guidance to registered providers on how to comply with their obligations to ensure the health, safety, and well-being of NDIS participants. What the emergency and disaster management practice standard does is it consolidates the advice and alerts that have been issued by the Commission throughout the pandemic, but also throughout other disasters like the floods and the fires that have affected many areas, including New South Wales and the ACT early in 2020. During that time, all the provider alerts and the practice alerts and the guidance that has come out has been consolidated in this standard. So it's all available in one spot, and providers don't constantly have to go in and try to find them on our website. The intention is for it to provide stronger guidance about what should be in place to prepare for, to prevent, to manage, and respond to emergency and disasters that occur as part of the delivery of services. The intention of it also is to ensure that risks to participants during this time are mitigated and considered. So hence the planning aspect. It is all about considering who are you providing supports to, in which environment are you providing those supports to, what supports are you providing, and how are you going to mitigate that and ensure the continuation of supports and services during an emergency or disaster management, including a pandemic. The emergency and disaster management standard also came about as a result of a recommendation that was made by the Disability Royal Commission, and they made that recommendation following evidence that was given to them about experiences that people with disability had during the COVID pandemic. And also it is the Commission's experience in supporting providers in responding to questions and queries that came up from providers during that time. There was extensive consultation that occurred, And we're hoping to continue our communication with providers around what our expectations are and how we can assist them in ensuring their compliance with this. Parties that were consulted as part of this practice standard being developed were people with disability, industry peaks, advisors with expertise in pandemic and infection disease control, and also the Commission's consultative committees. The primary thing for this standard is planning. And one of the things, having recently been involved in the outbreak and having a few people also on the call who were involved in the outbreak that occurred in the ACT recently, a provider having a plan and a well-documented plan in place and ensuring that that plan is communicated to all parties involved, being their workers, being participants, being families, guardians, and anyone who supports the participant, allowed them to address any outbreak in a very safe and well-handled manner. It also ensured that their staff had confidence in the way that things would be handled, and it meant that they had engagement from their teams, and teams were willing to assist and provide additional support during an outbreak, especially where there was a large number of workforce that may have been out, either being positive cases or having been identified as close contacts. Another imperative thing about the emergency and disaster management standard is the consultation aspect. And that is all about ensuring that you consult with all parties that this will affect and do that consultation prior to it. Consulting with the participant where they have capacity to do so. If they have a guardian, consulting with the guardian, consulting with the families. And including in that consultation is letting them know what you're putting in place, but also how you're going to communicate with them should something occur. Should there be a flood or a fire and you're required to evacuate your whole premises where the participants are, how are you going to do that? Where are you going to move them to? What are the options that are available? It is all about putting practice measures in place to ensure the health, safety and well-being of participants are measured. And again, it is about that continuity of support. If your premises is affected as a result of a flood, a pandemic or a fire, and you need to move all the participants, having an idea of what other premises do you have available? What are the other providers in the area who may be able to assist? Do you have another property that may be vacant that you can move people to? That is part of the planning, understanding your demographic and understanding the demographic around you. And also one of the important things that we did see was collaboration amongst providers, knowing your fellow providers in the area and how you will work together during this. And that came through very clearly during the pandemic, is where we had providers assisting each other with workforce, providers assisting each other with their outbreak management plans. And we even had providers who, while everyone was struggling to get PPE equipment, still being able to share what they had to ensure everyone was providing safe and supportive care to participants that they were delivering services to. That communication piece is also extremely important, not just communicating what your plan is, but having a very clear communication plan about how are you going to inform families, friends, guardians, and the support network of participants, and also how will you communicate with your workers and with participants themselves to let them know what is happening. What we saw during the pandemic was a lot of providers use various different modes of communication, and at times it would have been done virtually in group meetings, at times it was done individually. They held numerous different sessions to ensure that families and friends or guardians who weren't able to come and visit or see the participants were able to engage. Having all of that planned out early and having it communicated prior to anything happening builds confidence in your ability to deliver services during an emergency or disaster. And that is imperative. If your workers have confidence in you, if the participants have confidence, And if the families, guardians and support networks have confidence, it's much easier for you to continue to deliver services and to address and deal with anything that occurs when an emergency or disaster occurs. The third important aspect of the standard is training, and doing that training before anything happens, and also doing refreshers on a regular basis to ensure that anyone who works for you, anyone who starts working for you, and people are continually being aware of what they need to do as part of not just this practice standard, but across the board of practice standards. Your workers knowing where to go and find your policies, procedures and plans, who to speak to, and who the key people are should anything occur. Who is the person who is going to be in charge should an outbreak happen, should a flood or fire happen, who will be the coordinator, who will be coordinating all of this, who should be their main point of contact. And in some providers during the outbreak, we saw that it wasn't necessarily the CEO, but it could have been another senior person in the organization who was coordinating everything, allowing the CEO to handle other aspects, like if there were going to be financial implications, if there was going to be media attention as a result of it. They were able to address all of that, while there was a secondary person who was coordinating all of the day-to-day aspects. So having that plan in place, having a disaster management committee available and ready, and being able to pull them together as soon as something occurs. And that training is for that committee and what they would need to do. It's for workers so they know who to call should anything occur. It is for participants and also for families. If you would like to share the training to say, this is how we're going to implement it. And again, it is about building that confidence. There is also the review and constantly reviewing it. One of the things that became quite clear during the pandemic, during the current outbreak, and quite a few providers said it, is following what the outbreaks last year, a lot of them had put in business continuity plans, outbreak management plans, but when something happens, those plans straight away need to be reviewed, or they haven't addressed all the different aspects that are required. So constantly reviewing things as new research comes to light, or as new information comes to light, or when you attend these sessions that are run regularly by the NDS, asking questions where providers may have recently been through an outbreak, or recently had an emergency or disaster that they've had to manage, and what are some of the things that they saw happening as things were unfolding, and you will be able to include them in when you review those plans. Plans are great to have, but if they're just going to sit on a shelf and gather dust, then they're not really going to assist you when the time arises. So it's important to constantly review, constantly speak to your peers to see, is there something they already have in place that may be able to assist you? As part of, and I mentioned as part of training and having committees around, constantly having that committee involved, doing like we do fire drills on a regular basis, having a drill will also assist in making sure that you're prepared should something occur, because everyone knows what their role is and everyone has a clear idea of what they have to do. And lastly, it is about continuous improvement. And this is where we work together. If you identify something that may or may not be included, or something that you're doing really well, please share it with your with other providers, but also with the Commission, where we constantly get phone calls from providers seeking guidance. And a lot of what we share is what we may have heard from providers saying, this is something we put in place and it worked really well. Or this is something we put in place, but we made changes or tweaks based on the size of the service or the nature of the services they provide. So please constantly share, because continuous improvement is definitely part of what we all do and part of something that we should constantly be sharing. I will move, and most of you know about the NDIS Code of Conduct. But I'll briefly just put it up so that you're aware of it. So this is the aspect that applies to both registered and unregistered providers. And it is about providing safe and competent care, which again links in with the practice standard, and ensuring that we do that in a transparent manner, which links up with the reviews and the training that we provide, so everybody knows where they stand should anything happen. And the very last thing, Kerry, and the last slide is not the next one yet, thank you. And this is just where the obligations are. I saw a few questions popping up about what happens with unregistered providers. So the code of conduct, and specifically the one about safe and competent care, continues to apply to unregistered providers. So should anything occur, that is a practice standard that still applies to them. That is the end of my formal presentation, but again, more than happy with my colleagues to take any questions that you have as a result of what was discussed today.
Lovely. Look, thank you very much for that. Now, there is a question we have here that says, I'm a registered sole trader for support coordination. How do I complete my emergency and disaster plan?
Sorry, trying to click all the buttons to unmute and make my video available. When you say, how do you prepare it? Could you clarify that question as in what do you need or how do you go about it?
So, Robin, do you want to just talk a little bit about that as it was your question?
Sure. Yeah, so I understand what the emergency and disaster plan is. However, I'm a sole trader. My business is private, like I live in a private home.
Yes.
I provide services, implement services for participants. So I'm just wondering, do I sort of base that on my home if I was to have a fire or a flood or I don't know, and then how would that impact on me in providing, like implementing services to my participants?
So, Robin, in your circumstance, as I mentioned, everything with the practice standards and how it should be implemented is proportionate to the services you provide. So I guess in these circumstances, it would be if you provide services to a specific group of participants that may be in a group home and something happens in the group home, how will you ensure that you continue to provide services? That's one arm. The second arm is obviously, as you said, you're a sole trader. You run your service or your company from your home. If something were to happen and there was a flood or fire that impacted that, how will you continue to provide services? Is it feasible for you to continue? Are you going to move to another premises and continue? Do you do it face to face, and how will you continue to do it if you are addressing? And I was involved with a company that did a lot of work during the floods and fires, and I know one of the things that happened is at times workers were impacted as a result of it. So in your circumstance, if you're impacted and you need to cease services, how are you going to ensure that the person is still supported? Is that you're communicating with the provider who is providing core supports and let them know, and in emergencies, how can they contact you should the need arise? Or it is that education piece with the participant to say, if something should happen and I need to close shop for a few weeks because something's occurred, where are the alternatives that they can go to and who can they receive that supports to? So in your circumstance, I think it would be quite individualized, and it would be, what will you do if something happens to your place of practice, and how will you ensure that you liaise with, and is there an alternative that you can send them to?
Yeah. Okay, thank you.
Okay, thank you for that. So we have another question here. So this is from Mariam, and she wants to know what the role of the governing body is in the development of the plan.
So this plan, this practice standard, so this will be practice standard 18A in the legislation. So it's similar to practice standard 11, which the responsibility sits with the governing body on this one. So it is, the obligation is on the governing body to ensure all of the practice. Sorry, I'm just trying to find a document that clearly identifies that. And I will send that through, Kerry, to yourself so you can share it with everyone, which clearly sets out that the obligation for this, it's similar to the practice standard that sits under section 11, and the obligation for this applies at an organisation level. So it is with the governing body itself. They need to ensure that everything is available and in place, and that the governance around it sits at that level, and that it's sent through to all of the different group homes and the house managers for the group homes. I hope that's what the question related to, but I'm happy to be corrected and ask clarifiers around that if I haven't hit the mark on that question.
So Marion, does that answer your question?
I could have been totally off the mark. I apologize if I am.
Okay.
So Miriam responded yes.
Okay, beautiful. All right, so now the next question we have is, are we going to discuss mealtime management standards on dysphagia today? So can you talk a little bit about that, please?
I can send out the practice alerts that have gone out in relation to mealtime management. I think the biggest question I'm getting around dysphagia, and it's something that I've asked the national team, is some of you may be aware that as part of the practice standard, we've used the terminology severe dysphagia, and that is not something we've used in practice alerts before. So I've gone back to the national team to say, because I had a few providers raise with me if the Commission had a definition on severe dysphagia, and I've gone back to our national behaviour support team and sought that. So I'm hoping to have that, and I will definitely share it with Susan, Kerry, yourself, and also Kat to make sure that you can provide it to all your networks once I have that definition. In relation to mealtime management standards, again, the quality indicators for that are available, but if you've got any specific questions, please send it through to myself and I'm happy to prepare responses. But what I will do, Kerry, is send you through the practice alert that was sent out about a month ago. I want to say either late October or early November. It would have been late October because it was before the practice standards were released, that clearly identifies the purpose and what is required of that. And I think that will provide a lot of clear guidance around the mealtime management. There is also some work happening through a grant and to get a lot more guidance around that. And as soon as that's available, I'll circulate that as well for everyone's information.
Lovely. Now, look, Carmel, I actually do notice you've got your hand up, and I know that was your question. Do you want to just ask your question?
Yes, hello, thanks, Kerry. Maharshini, I was the Dietitian Australia representative on the KPMG focus group yesterday on mealtime management standards from an NDIS perspective. I also had Sharon Carey from RPA Hospital in Sydney as well. We were a little concerned about the lack of dietitian involvement in those practice standards and those prep papers, and the role of the dietitian in keeping people with a disability safe when you've got extreme severe dysphagia, and also we've got one paper on enteral feeding as well. So where's the best place for us to go back to actually have some, I suppose, input into what those high intensity support skill descriptors are for people, for disability support workers?
Carmel, I will give you the details. I'll send an email through to Kerry and Susan with the National Behaviour Support Team. They're the main contact point because mealtime management and dysphagia is part of our behaviour support aspect. So I will send through their details and you can definitely raise it with them if that's workable.
That would be very, very good. Yeah, we were just very concerned that what we saw yesterday across those papers, from our perspective as dietitians and Dietitian Australia representatives, weren't going to keep people with a disability safe.
Yes.
And it was almost setting disability support workers up to fail with you know, we don't have any tools in relation to what we can train them with on the 22nd of January or moving forward yet. So there's a lot of work to do in that space.
I will definitely send through to yourself what the contact number and the email for the National Behaviour Support. But in the interim, I'm more than happy if you sent it through to me, because similar with other providers have raised aspects with me about the dysphagia practice standard. I'm more than happy to make sure that it gets sent to them and also regularly follow up to ensure that you've got a response. But I will provide that email address through to you so you can liaise directly with them as well.
Be fantastic.
Because there may be aspects that they need to speak to you about that I am no way an expert on, and it's better for the two experts to have the conversation than for me to try to be a little wheel in the middle trying to understand what's happening from
I know, and that's what we found yesterday with KPMG. They really, it was almost like, yeah, we were talking a different language in some ways.
Yes.
So, yeah. If we can inform those descriptors in more clinical and correct way, then that would be really, really good. It'll save the confusion moving forward.
No, then let me definitely give you the details of the right people rather than me trying to understand exactly what you're trying to ask.
Thank you.
Kerry, you're on mute, I think. Sorry.
Sorry, Wendy, I might just quickly go to you.
Thanks, Kerry. I'm going to be deliberately provocative here, and so I accept my apologies or not in advance. Just to clarify, the meal management practice standard is obviously a concern to people, but this session is actually on the emergency management practice and disaster management guidelines. And I'd like to actually put a challenge out. Those providers that have gone through COVID and had cases or close contacts will understand this, you know, but we're coming up to Christmas. How many providers are convinced hand on heart that they are ready if they were to have an outbreak at their facility? How many providers feel that they, and I said I was being deliberately provocative, so sorry, but how many providers really understand what that practice guideline means? How many providers have gone through their floor plans and identified where their donning and doffing stations would be? How many providers have got a PPE pack ready in the event? And not just residential providers, if you're providing support to people in their own homes, have you got PPE packs? How many providers are, and this is really important, how many providers have a workforce contingency plan? How many providers have linked in with another provider to see if you can share workers? How many providers have registered with the NDS workforce project on the portal? This is what, to me, what these practice standards mean. It's about pulling everything together. So, and if people are, you know, if providers are struggling with this or have got questions, I'm really urging, whilst we have this opportunity with the Commission, that people ask those questions. Sorry.
Wendy, I think you've raised some really good practical things that providers need to have in place. And you and I were involved during the outbreak, and things like, you know, PPE packs, go bags, with everything they need for a participant, you know, their behaviour support plans, what are their medication, how is it going to be? So they're all the practical things that someone needs to have in place. But I think you've raised a perfect question. Or, as you said, you know, provocatively try to address that.
So look, we would be really keen if people, you know, do have some feedback, because, you know, I agree, you know, very provocative, Wendy, but very, very important issues at this point of time, particularly, you know, as we are coming into the festive season. So do people have any questions or anything that, while we've got the right people here, that, you know, you'd like to answer or would like to ask at this point of time? So Heather, I might ask you to unmute.
Thank you, Kerry. Mine's actually a comment just to remind people that in terms of your COVID outbreak management, that NDS does have the first 24 hours documents, which actually state what you need to do in the first 3 hours, the first 30 minutes, 6 to 12, etc. And if you want to just read through that, it does give you a reminder of all the things that you actually need to have in place right now. I'm about to put the link in the chat for everyone to get to that site, and to let you know that we also have a PPE supply calculator that's just being finalised to go up on the website as well. So that will be there, if not later today, by the end of this week. But they're really important things that you can look at now and will help you in preparation for all of the things that Marshini has spoken about. It's one part of your picture. I know that flood and fire and that are another whole package, and that they do require you actually looking through each of those steps. And we're looking at providing some more resources around that in the next little while.
Thank you for that, Heather, and that was, really timely advice there. Carmel, I note that you've got your hand up.
Yes, thank you. I'll start my video again. One of the other issues, Harshini, and I'm not sure if this is, because I know the NDIS Commission doesn't cross against the NDIA or the agency, but I believe Julie Basso's online, she might be able to answer it. In keeping people safe and offering quality services, again, in these high risk areas of enteral feeding, mealtime management, we need to, number one, ensure that the plans are accurately funded or adequately funded. There's no amount of good planning, good assessment, good prescription by dietitians, good follow through by disability support workers if there's no funding in the NDIS plans for us actually to be able to provide these services to keep people with a disability safe. So I'm just wondering what the Commission is doing as far as liaising with the agency, especially around funding for dietitian support services within NDIS plans and nutrition support products that are actually needed to do these two areas.
I think you mentioned Julie is online, so she can probably provide some of the more detail. But the two agencies work very closely together, and we ensure that if we are going to introduce something, we have conversations with the NDIA and they're aware of what's going to happen. As you've rightly mentioned, we are quite independent of them. So our regulation and what we introduce sometimes, it's something that we will let the agency know in relation to its happening and consult with them. With the funding, I'm hoping Julie's still online, but she did mention something at a previous session around at the Hunter New England one. So sorry, I don't want to say the wrong thing.
No, that's okay, Mahashini. It's Julie.
Sorry, Julie.
Yeah, just I guess in regard, any funding in a plan is still going to be subjected to the legislation and the reasonable and necessary. And I can only reinforce that having detailed reports and evidence that requires certain supports is critical to ensure that decisions can be made based on information provided. Obviously, I think there would be feedback from people who may question some of the decisions at times, and we would go through the usual process to review any decisions that are made. But we'll work with the Commission in regards to requirements and look at any impacts that might have on participants' plans and funding. But we still are governed by the same legislation and rules with all decision making. Was there something specific, Mahashini, that I mentioned to meal management plans that you can jog my memory, because I can't recall?
No, I think, Julie, you've mentioned exactly what you did now, but I knew you were more eloquent in mentioning it, and I thought, I really don't want to fudge this thing up.
No, that's okay. Just probably while I've got my camera on and talking, I'll just mention as well, there are resources on the NDIS website that the contingent care panel members have made available to providers. So the link is on the website, but they've released a number of resources that can assist providers during specific COVID outbreaks. And so there is a lot of information. It is focused on supported independent living, but I think there's information in there that can be used also in supporting participants in the community. And to just reinforce that through my engagement with providers across New South Wales and ACT and even Victoria, people who have prepared detailed, well-considered plans manage the situation in a safe manner for both their staff and the participants, and where they can review after an outbreak, reviewing that to see where things worked really well and where they needed to tweak or make some improvements. It was required. And I think it's just important to constantly check back in on your plans because we know things change and requirements change. So that's really important. But yeah, our website, the NDIS website, has information that providers have developed. So it's a peer support and information that they're practically using.
Thank you for that, Julie. Now I will go to Linda and to Jessie. So Linda, if you want to unmute.
Thank you, everyone. Look, my question is from a support coordination perspective. So I understand that we obviously need to have our own business continuity, plan in place, as well as supporting our participants to develop their own plans. I guess my query is around, do we have an obligation as a support coordinator to ensure that support workers and supports that we've assisted to implement for a participant have addressed those areas as well? Or does that solely fall onto that particular provider?
Linda, I would say as many people who are ensuring these obligations are met, the better. It ultimately falls on the organisation and the governing body. As I mentioned, that this practice standard sits on an organisational level. However, as support coordinators, you play an integral role in ensuring that participants are receiving safe and competent support. So I think it's not something that, but if you are working with a provider, ensuring that they have and are addressing these requirements would be quite important.
Yeah, no, that's cool. I thought best practice, absolutely, but it's more just that obligation as far as the Commission is concerned to cover off as well. So thank you for that.
Thank you for that one, Linda. I'll go to you and then I will actually then pick up some of the questions that are in the chat. So Jessie, over to you.
Thanks, Kerry. My question, I've put it in the chat box. So what registration group will need mealtime management and severe dysphagia plan?
I responded, Jessie, to that saying I will send out some information that will provide details of the registration groups that will require to meet that. I do apologise, I don't have that on hand and I don't want to make sure I start mentioning the wrong registration groups, but there is guidance around there. So what I will do is I'll ensure that I send that and it lists the registration groups in there. So I'll definitely, I know that's
sorry for asking.
No, please, Jessie. No, I'm glad because people may not have actually read my comment. So it's really good that you had. And because I think a few people have asked that question. So I'll make sure I make the publicly available information available so you can go through and see if it's applicable to the groups you're registered for or not.
All right. Thank you.
Kerry, do you mind if I just respond to one question?
Yes.
Sorry, the answer popped in my head and I thought, while I've got it in there, it is a really great question around fire drills are quite, straightforward, but COVID scenarios have multiple facets and how do we test and do, we have fire evacuations on a regular basis. And I'd love to hear from others and Wendy specifically, because I know you assisted a lot of providers during this. But one of the things that I thought would be, and I know the NDS, you did a really great session with 4 providers around how to be prepared for it. And a provider that had an outbreak came and spoke about their experiences and all the different facets that they underwent during an outbreak. So again, here I think it would be that collaboration, and NDS is a great conduit for that. If you don't mind me saying that, is linking up with providers who may have had an outbreak to understand the different facets and scenarios, because you definitely can't do a drill for it to say what's going to happen if an outbreak occurs, but it's more about speaking to providers where an outbreak may have occurred and they'd be more than willing to share their experiences and taking from that experience what are the different facets that have come up and how we can address that. Things like PPE and how to wear that properly, I think they're things that you can do in a drill so staff are aware. And Wendy did mention donning and doffing. So, just for each property that you are responsible for, knowing where you're going to set up the donning and doffing stations. But also one of the things that came up quite a bit in some of the outbreaks that I sat in New South Wales, less so because I think the ACT providers were quite were really good, and there was someone really great from health who did the infection prevention control assistance. But having that regular conversation around infection prevention and control, and having staff train in how to properly wear the full 4-point PPE and understanding what that is, it can be quite uncomfortable, but just people being constantly reminded about it is a very good part of the drill that you can do in a practical sense. Whereas the others, I think it's learnings from those that have recently been through an outbreak, and how they addressed it will address some of the facets that came up in the question.
Thank you for that. And I might use that as a segue to actually point to, we've got a very good donning and doffing PPE video that is on the website. So I really would urge people to have a look at that. Now, I think it was Renee, but it says Susan, but I'll go to you first. And then after that, Heather, I'll go to you.
Thank you very much, Kerry. Look, I just wanted to shine a light back on what Wendy Kipling said. If you're on the call today and you're struggling around continuity planning, and that may be in regards to COVID or any other disaster recovery kind of issues, our services at Boosting the Local Care Workforce Program are here to help NDIS providers. It's a free service. I would encourage you to use them. I can meet with you one-on-one to have a discussion with you about what your needs are, and I can talk to you about your continuity planning in relation to your organisation, especially if you're not comfortable around asking certain questions. But it's a safe space and it's confidential, and more than happy to help you one-on-one with that planning. And I'll put my details in the chat.
Thank you for that, Renee. I will go to you, Heather.
Just to reiterate that we have a number of providers that have worked with us from around the states that have had COVID outbreaks, who are very willing to share their experiences and learning, recognising that everyone's experience will be unique, but certainly wanting to be available to just talk about what worked well and what didn't, because we're all in this together, and we want to support each other, and we don't need to be reinventing the wheel. So just contact Kerry or any one of us. And I've also put in the events and training link. There is a national COVID outbreak vaccine kind of management community of practice that anyone can come to, and there is real sharing in that each month around what's happening and how can we learn from each other. So lots of different options available.
Lovely. Look, thank you for that, Heather. Now, Jessie, I don't know whether that's an old hand up or a new one up. So not sure about that. So the hand is gone. So that there are some questions. Now I need to have a look at where we got to all the questions online as well. So is there a particular list of emergency and disasters, or do you need to assess that yourself?
That is a self-assessment based on where you're located and what different emergencies and disasters could impact. There is no list. It just is broadly emergency and disaster management, because different areas could have different things arise. If you're next to a gas station, for example, that could be a disaster that none of the other providers have to be concerned about. I'm just using that as an example. So I think you need to assess it for your situation, and also potentially if you have multiple group homes, for the group home itself, to see what are things that could impact, because some may not be impacted by floods or fires at all, while others may regularly be in one of those areas. So that is something I think the provider will need to go through and assess.
Lovely, thank you for that. So we have another question. We have a few that are related. So it says, can I please clarify that these standards refer to managing emergencies or disaster in the context of that service, or does this extend to ensuring participants are prepared for emergencies more broadly?
I think it's both. It is about continuity of support. It is about the health, welfare and safety and well-being of a participant. So it is in that setting as well, but it is also broadly for emergencies and disasters.
And I think that that's sort of answered the next question a little bit as well. So is there a requirement for support coordinators to ensure a participant's support, i.e. support workers, have addressed the requirements for this practice standard?
I think I answered that one when someone asked the question. Yes, sorry.
That was mine, sorry.
Yeah, sorry, just trying to go through these. Let me see. I'm just trying to get some of the key ones, because a lot of these we will be able to answer outside of the session. So there's a question which is, if my service does not involve a mealtime, do I need a mealtime management plan?
I will be sending out guidance around that, because there is a list of registration groups that it applies to, but not knowing it off the top of my head, I don't want to give the wrong information. So Kerry, I will provide guidance around that, so that can be shared with the network.
Lovely, thank you. Look, there's I'm very conscious we are running out of time. Now, there is one here from Carol Tonkin, that basically just to everyone, just that the ACT Health has guidelines for planning, and Carol has actually put in the website in the link. So if people want to copy that down, I think that's an absolutely invaluable link. And basically, Carol has actually said that these documents may be reviewed soon, but still worth a look. Now, Wendy, I think this is quite a pertinent question as well. How will the Commission enforce the new emergency standard? So
we'll enforce it in definitely. We'll enforce it in exactly the same way as we do other practice standards. If we receive a complaint or we receive a reportable incident, or something comes to our notice and we realise that there is a breach, it will be identified as a breach and there will be compliance action or investigative action. And I think one of my slides was around what happens when things go wrong, and that was the corrective dimension. So we will take any corrective action needed, starting obviously with the education piece, because this is a new standard, so we're not going to jump to the more severe one. So we'll go through an educative piece, work with you to see how we can assist in correcting anything that's happened, and then it'll progress down compliance notices, infringement notices, banning, civil penalties. So it'll fall within the same regulatory framework for compliance and enforcement that we currently have in place.
Lovely. Now, look, just one last question, and it just says, are there still person-centered emergency preparedness planning for COVID-19 booklets still available? Oh, and Sue's actually just said she's got a box in her office. So I think we've answered that. Look, we will need to wrap it up because it is right on 1 o'clock. Can I just thank you very, very much, Sheeny? It's been a very interesting session. The number of questions have been phenomenal. Now, everybody, this video and the slides will be available, as I mentioned earlier, on our ACT COVID Hub. Sue will also actually send out the actual slides as well. But I just want to thank you all. Thank you, Julie, for answering some questions as well, and for everybody who's been able to attend today. So talk to you all soon. Thank you.